So reimagining your wellness journey. Let me tell you a little bit about myself. I've been with MESSA for about probably 20 something years now. I started as a nurse. I'm a registered nurse in the medical case management department. From there, I went on to become the cardiovascular education nurse. We had an area in MESSA, within MESSA, resource for members that were diagnosed with cardiovascular disease. After that, I took on this role as the health promotion consultant. What I do as a health promotion consultant is I help you, members like you, create worksite wellness programs. And what that looks like is, if this is your first time here, I see a couple first timers. What that is creating a worksite that supports healthy habits, right? So often, our workplace is where we get sick. It's an unhealthy place. And as adults, we get so many messages. We see billboard messages and we see commercials about how we need to eat healthy, eat more fruits and vegetables, get more exercise, move more. But we work 8 to 10 hours, especially those of us in the public education industry. You're working every day, long hours, and even on the weekend. So worksite wellness is a way to bring or transform your environment to support your healthy habits or those healthy habits you desire, right? So re-engineering the workplace, there's where you create perhaps more signage that promotes healthy habits, more activities that promote healthy eating. I go out and I help our members do that. I can help you form a wellness committee, and I can help you create a curriculum. I am a bachelor's prepared nurse with a master's degree in health promotion and health behavior. I also have additional accreditations in case management and health education, personal training, and nutrition. Actually, I have a little background in fitness. So I use my skills and my experience to contribute to you and your creation of a wellness program, okay? So as MESA members, this is your privilege. This is one of our resources that we provide you. As a MESA member, this conference is for you. No one else gets this. We have nationally national speakers, nationally known is the word I was looking for, that we're bringing to you to help you, and you get credits for. So this is a very valuable benefit that MESA brings you. And I wanted to say me too. I come out to you and I help you personally. So remember that, okay? So what I want to talk about is right now, I want you to think about, now that I've said that, and you're thinking about your work site, look around if you're at work, think about work. I hear a lot of people when I go out to school saying how stressed they are. I hear it in the chat, some people mentioning how stressed they are and they want to learn how to manage stress. And here's a free tip. I don't know if this is in my presentation, but there are statistics out there that say that chronic stress is most likely the root cause of many health issues. Many chronic health issues are rooted in chronic stress. So learning how to master our stress is a great idea. So reimagine, revisit, think about what your work site could look like after you leave here. What would you want to see? And these are some examples of some work sites we've worked with in the past, some different activities. This actually is an event we did for Wear Red Day. We went out to a school, and actually the school thought of it. It was a meeting talking about health. People gathered. We had a healthy lunch. Ignore the brownies on that plate, but there was healthy food during that event. Some different things you can do during that. I want you to start thinking about that. A walking challenge. This is one of my favorite groups, Warren Consolidated. We did Zumba classes after work. People gathered. Walking challenge. They did healthy lunches. This is something you can do, and I can help you create it. And I also gather ideas from other districts. Why work hard trying to create something that has already been created? So we all just share ideas throughout Michigan. Here's another Wear Red Day. We have districts that use social media. So depending on your population and your audience, you can use Facebook pages. private Facebook groups for those who are into social media and operate different activities around health themed days. Just for some ideas. Some other lunch and learn, healthy lunches. Just so you know, if I don't tell you, if I forget, I also provide professional development sessions. So I can come to your school district, to your staff meetings. We can do a professional development day on healthy topics. We can do fitness, nutrition, managing your stress. We'll bring a healthy lunch and help you and have fun. Some other things you can do. Now, if you're here and you're a leader, an influencer, you're part of your association, doing a wellness program is a great way to engage your members. When you need to get them enthusiastic about coming to an association meeting, add wellness to the agenda, wellness topic to the agenda, provide healthy food options. Okay, just so I provide the pictures because I want to stimulate some creativity, so you can start thinking now, start jotting down some ideas even now. So what I'm going to talk about today, and you may have heard this if you've been to my conference before, but we like to reiterate the information because we're still here for you. How to survey your audience, how to gather information about your audience so you can put it together as a program, and the resources we have to help you, and just some ideas for some wellness activities, and how MESSA programs can be incorporated in your worksite wellness program. Okay, we're a part of your benefit. And I want to say, I want to start off with this, and the other speakers are going to be bringing you information about how to create goals, okay, personally and collectively as a group. That's what Dr. Gardir is going to talk about. We're going to get some information about nutrition from Dr. Minnick. We're going to get information about exercise from Dr. Luque, okay? So when you hear those presentations, I want you to think about it not only for yourself, but how can I use these ideas to create activities for my work site, okay? So that's how the information is going to flow. So flow with me today. Survey resources. We have a health risk assessment, a health interest survey, and it's a wellness report card to help you. Now, this is tools to help you survey your audience. And I'm going to say this right now. If you don't have a lot of time and you're ready to kick it off, you don't have to survey. Survey is so you can get information to know what your population needs. I can tell you right off the bat, right? MESSA is your benefit management company. People are stressed. We know that. We get claims for depression, claims for diabetes. People are stressed. Stress causes that. People don't move adequately, and people don't eat well. So if you started a program with movement activities, nutrition education activities, and stress management activities, you're going to be addressing the issues without a survey. But let's talk about surveys. So the health risk assessment, we provide a health risk assessment. We have a vendor called MetaKeeper, and we provide this resource for our MESSA members, okay? So this would be a tool that you could use as a program planner. If you are the wellness liaison, if you are the lead program, wellness program planner, and you want to get some ideas going about what your population needs, and you have a population where everyone has MESSA, okay? You can use the health risk assessment. You can push them towards the health risk assessment. You can create a campaign where you make them aware of the health risk assessment. You provide a link to it, and you perhaps set a date where everybody does a health risk assessment or a duration of time. What happens for the people you're serving is when they do the health risk assessment, they fill out a questionnaire, okay? And it's a questionnaire about their lifestyle habits. How many fruits and vegetables do you eat? How often do you walk or exercise? Do you have diabetes? What is your blood pressure? And what happens, it takes about 15, 20 minutes. And they get immediate feedback on their risk for up to 60 different health conditions, okay? So why is that important? Well, in the world of health behavior theory, the idea is that people are more likely to engage in their wellness journey, take that first step to action, if they're aware of their risk. And that sounds simple. You're like, people should know what they're at risk for. We hear it all the time. Believe it or not, people don't know they're at risk because they don't realize that when they sit more than an hour that they're putting themselves at risk for a shorter lifespan, or they're not eating enough fruits and vegetables. They thought that one apple crisp donut was adequate fruit, right? They don't realize how many fruits and vegetables they need. So this is putting it in their face in a private way, okay? It's kept confidential. No one has access to it. Human Resources doesn't see it. MESSA, we don't see it. We see all your claims, but we don't see that, right? It's private. So that is how it helps you, and that is how it helps your program, kick off your program, get people motivated to engage in your program. Now, as the program planner, what it does for you is I can provide you a de-identified report. So there's no names on it. It's not individual, it's aggregate, and it's just telling you the risk of your population. So Warren Consolidated, for example, and this is not Warren Consolidated, school ABC has 80% diabetes risk. School XYZ has a high rate of people being sedentary. So you as a program planner and perhaps your team, you sit down with this information and you know exactly what to do. You don't waste any time because we don't have a lot of time, right? So you know right away we need to do a walking challenge, or we need to do some education on risk factors for diabetes so we can help our people, because behavior change begins with awareness, right? First, people become aware, and then they're motivated by their environment and the social effect. What are the people doing around them, right? So you start there by motivating them, by telling them, letting them know privately what their risks are. So that is for MESSA members, okay? I just want you to know that. Now you might be thinking, well, I can't use that. Everybody doesn't have MESSA. We have some people that didn't select MESSA. We have some people, some groups that don't have it, MESSA available to them. That's okay. Our philosophy around worksite wellness is, as long as someone has MESSA in the group, worksite wellness is all inclusive. We want everyone well. Okay, so everybody gets the benefit of MESSA, gets the benefit of the health promotion consultant and the activities, right? So what you can do, if you still want to survey your population, you can use a health interest survey. You probably can go to your browser, whatever you use, Safari, Firefox, Google, and put in wellness interest survey or health interest survey, and many different surveys will come up, okay? You can go directly to mesa.org, and we have a copy of one there for you, just like I'm showing you. And basically, you are engaging your audience. That's very important. Engage the people you want to participate. Often we make mistakes and we start planning things without knowing what people want to do, and then we're upset that they don't participate. When you engage people in the activity, they're more likely to participate. Get their opinion, okay? So you send out a survey, you ask them what they want to do, and then you craft the survey with what you can do, right? You don't want to put something on there like, do you want to take a trip to Hawaii for 2 weeks, right? And then you can't deliver. Everybody says, yes, yes, yes. You want to put things on the survey that you can actually deliver, right? And we have a copy of a survey you can use. And again, you bring that information to the planning table and you use it to help you craft your wellness curriculum. Last but certainly not least is our wellness report card. This is for our MESSA members, if you're a MESSA member, and this is especially valuable if your workplace is all MESSA, okay? And this would be those individuals that are looking to see how you can save money, or perhaps the superintendent puts you on an assignment, and usually people in those positions need to quantify things, right? So this is a report that quantifies things for us. So basically it's a snapshot of the MESSA members' healthcare utilization. How are you using healthcare? How is your group using healthcare services, and specifically those healthcare services that can help extend your health, right? So things like preventive care services, your wellness visit, your mammogram, things like that. What is your population doing? And this will show you things like, are people aware of what they have available to them in MESSA? You know, your wellness visit, they used to call it a physical exam. Your wellness visit is a free benefit. You don't have to pay anything for that. And we all know, we've heard this over and over again, that when you go to the doctor for preventive care type services, it's a healthier way to operate, right? Because early detection helps minimize emotional burdens and financial burdens, right? So we want people to know that they can go to get their physical free, and that they should. So again, this is telling you what is happening, kind of a snapshot of it. So how do you use it? Again, you sit down with your wellness team, and let's say you got all three resources. You have the health risk assessment, you have the health interest survey, now you have the wellness report card. You schedule your wellness team meeting. It might be you and your superintendent, or it might be, you might create a wellness team that has a representative from every building, or perhaps a representative from every role. You sit down at the table and you look at your information, and you can decide what's important and what can you do and what do you have the resources for. You might lay a calendar out and just start plugging in dates, and you'll look at your wellness report card and say, well, only 40% of our population is getting a physical, and they're eligible. There's more eligible. Most of them are eligible. So you decide that you want to do a campaign highlighting the importance and the value of a physical. And you might provide incentives, or, you just create things just like that. Okay. Again, so you have your health risk assessment. Ask your field rep about it, or email me if you want more questions. You have a health interest survey that everybody can do that, and you can customize it. We have it at mesa.org. Download it. You can add things to it. What I usually do is I use SurveyMonkey. I have it already in SurveyMonkey, and I can add things to it or take it away, send it out, get the information. You know how SurveyMonkey works. Easy to look at, easy to share. Okay. And then you have the wellness report card. You can easily ask your field rep. They can even come out and explain the wellness report card with another medical report if that is what is needed. I can come out and share information on the wellness report card. I can sit with your team and help you craft a program based on all three of these resources. Okay. And if you have questions anytime during this session, go ahead and put it in the chat. Our team is looking for that out there, and they're going to help us answer, or they're going to let me know I need to answer a question. I can't see the chat right now. So some other resources. This is because you have MESSA, okay? I'm building the value of MESSA. MESSA is a great benefit. So I want you to know about all the resources, because often, you have these things and you don't know about it. You don't know. I've talked to people and they were like, I'm retired now. I didn't know about this. So I want you to have a heads up now, okay? So resources, we have a toolkit, step-by-step, with some of the ideas that I've mentioned, an activity calendar that you can download, print out, lay on the table with your planning committee. You can print it out in 11 by 17 if you want, and just start plugging in dates. And we have templates, some basic campaign templates that you can find at mesa.org, okay? So a wellness committee. What I usually recommend some of our wellness liaisons to do when they get started, especially if you're a big district and you want to do big things, don't do it alone. Mobilize a team, right? And I have an email I give them. You're basically kick it off a meeting, a wellness meeting. Sometimes they call me out on the opening day of school to get everybody going and invite them to participate in this wellness initiative. Get volunteers. You have people in your district right now that need something to do, or perhaps they have skills they want to share. When we first started our Worksite Wellness program at MESSA, probably 10 years ago, we didn't first start it, but when I first got involved with it 10, 15 years ago, my first contribution was a Zumba class. And I'm in the MEA building right now. We used to do Zumba after work, Monday, Wednesday, and Friday as a group. You have people in your district right now that want to teach yoga. They want to teach Zumba. They want to teach people how to practice mindfulness. You have the skills, and they, a lot of these different types of teaching crafts, they need hours. So they want to volunteer their time. They want to get better with you. So they want to do it for their colleagues. You can make that a part of your survey. Okay. And you can make them a part of your wellness team. Okay. Go to MESSA.org. They probably are going to put it in the chat right now, the Worksite Wellness Toolkit, so you don't have to go all the way to the website. Okay. Activity calendar. I like to, and the reason why I have this calendar, and we have one that shows the 12 months, is when I sit with wellness teams, that's how they operate. They pull out a calendar. You already know your school calendar. So just pull out your wellness calendar and start plugging dates in, okay? Now, don't forget about what I can provide you, lunch and learns, but you got to contact me before, like at least 3 months before. I'm already booked for the fall, but I would love to come out and provide a healthy lunch and talk about fitness and talk about stress management. Start loading up your curriculum right now. We have to plan ahead of time. And campaign templates. You can find those on our website. So we have templates that help you create campaigns around doing a stress management campaign. Or if you want to grab that idea about getting your physical, we have that on our website. And I like to do a lot of things around mindfulness, movement, and nutrition. That's my philosophy. The way I put it in my head, most situations can be addressed with the principles of mindfulness, movement, and nutrition. It seems like that those words just flow. So I like to put them together. Mindfulness, that's to me is the answer to stress, managing stress, practicing focus or presence, bringing your thoughts into your actions, right? Movement, I already said most adults are sedentary. We're not moving enough, and stress can do that to you, right? So movement activities and nutrition. If you just thought about those three principles, if you didn't do a survey and you just operated off of those three principles, you are addressing most of the issues that are happening, most of the health issues. You're helping people that are challenged with diabetes or at risk for pre-diabetes. You're helping people that are challenged with hypertension. You're helping people that are stressed out. So when you help people learn those protective factors that help either manage the condition or minimize the onset, you're helping them save money on healthcare. So anybody out there that's concerned about healthcare costs, if I have my condition more controlled, I'm going to go to the emergency room less. I'll probably feel better at work. I'll be more productive, right? So that's how you create a wellness culture. I'll get along with people better. And if I'm sleeping better, I'm happier. And I'm making a joke about that in this room because I didn't sleep well last night. But when people don't get adequate sleep, adequate nutrition, manage stress well, we're not always optimal. So when you're able to share the information that can help them during the workday, because we're at work all the time, that is a benefit to your colleagues, your coworkers, and your employees, your members. So when we're talking about mindfulness, some things you can do, right? You're going to get these slides, or you can take a picture of this. Say you want to start a mindfulness program right now. You're thinking, everybody on my job, including me, we're all stressed. The school year just kicked off. We need to practice some mindfulness because we know what the research says about mindfulness. People that practice mindfulness have lower incidence or prevalence of depression. People that practice mindfulness feel more joy, right? People that practice mindfulness have better controlled blood sugars and blood pressure. So let's just start a mindfulness program. So some things you can do: a mindful Monday email. You can call it whatever you want. You can call it Think About It Thursday, right? Because mindfulness is really about thinking about what you're thinking about, right? You can name it something fun, or you can just put it out there. But basically, you're sending out messaging about mindfulness. Remember what I said, or I may have not said it, but I'm going to say it now. The first step in helping people is to raise their awareness, and then you educate them. So this is a way to educate them. And that's what Worksite Wellness is about. That's what health promotion is about. It's really about helping people change behavior. I don't know if you realize this, but since you stepped into the Zoom, You are all behavior change specialists now. Yes. Yes, you've been hired. You are the ones. So you're going to help people change behavior. And we know that it's hard to change behavior. Some of us have been doing this for 50 something years, right? It takes some time, but we know the theories that work and bring awareness and education. If you did nothing else all year, you're thinking she's giving all these ideas. She's talking about a year-long curriculum. You just need to pull out one thing, and it might be a Monday email telling somebody about mindfulness, or perhaps putting a meditation on the email, or posting it on the break room wall, or sending them a link to My Stress Tools, a resource from MESSA. And I'm going to tell you about that. Is my chat okay? It is okay. And what am I doing on time? Oh, movement. We all know exercise helps us. We know intuitively. If we've been sitting all day, or if we haven't worked out, when we do, whether we feel like it or not, once we do it, or at least get about 20 minutes in it, we're glad we did it. You know how that is. If you can just get there. When I don't feel like doing anything, I say, if I can just get there and get 10 minutes in, if I still don't feel like it, I'll leave. But once I get that 10 minutes, I'm like, well, let me go ahead and do 10 more. And let me go ahead and do 10 more. Movement is very, very important. And right now we have a growing epidemic of people being sedentary. And stress, a heavy mindset, can make you want to just lay on the couch or just sit there and not move, right? And we know the benefits of movement. Movement can help us build and maintain muscle. It can help our joints. It can help our flexibility. Movement, and I always talk about diabetes, because diabetes is a epidemic, right? Insulin resistance. Movement can minimize insulin resistance. It can help us use the glucose in our bloodstream instead of it causing our blood sugar to go up and then our A1C to be elevated, right? If you're over 40, I'm gonna just free tip here. If you're over 40, you're at risk for diabetes. So we got to start moving more. Okay. I know our infrastructure doesn't support moving these bodies, but these bodies are built to move. That's why you have 2 arms and 2 legs. So incorporating that in your work style, your work life, your work culture is very important, especially if you're the type of school employee or municipality that is sitting a lot. Now, I know I have some elementary school people, and when I'm at elementary schools, I got to chase down our members because they're moving. They're getting their exercise in, but then there's those roles that sit, okay? So it's better to move. And I'm not suggesting you do a marathon or get in a bodybuilding contest or you have to go join a gym. There are things you can do to keep people moving at work. And here are some different things. A walk or step challenge. Everybody loves step challenges, movement challenges, and you can be creative with that. It doesn't have to be walking. It doesn't have to be so competitive. So you can make sure it's all inclusive. It can just be about movement and people finding that move that they feel joy with, they enjoy, and that they'll be consistent with. That's what's important. Also, with movement, the great thing about incorporating it during the workday is that we know when motivation is low, having a support group or support person can be very, very effective. That can help us going. So when I'm down, they can say, come on, let's go, let's break. I don't feel like a girl. Come on, let's go, let's walk. You always got somebody that'll go. I call it that social effect. When everybody in the office is getting up and going walking, you thought you were going to skip today, it's more likely that you're going to go get that 15-minute walk into, because you don't want to miss the juicy gossip. They're going to go out there and talk. So you want to be involved in that, right? So doing it during the work, some things we've done in our Worksite Wellness program. And I smile when I think about it. We did a plank challenge, okay? And this was during kind of the shutdown time of the pandemic. So we did it on Zoom. And it was so fun. We had great participation. And we did it where it was the last one standing, the last one planking that won the prize. So you can be creative with things. It doesn't just have to be movement, but walking challenges are easy to do. Group exercise during the lunch, a 15-minute movement, a 15-minute Zumba workout with people during lunch, bring a video in. Nowadays, I see a lot of screens in the schools, in the lunchrooms and in the break room. You can put a video in and everybody do some stretching or everybody do some dancing. Put your iTunes on and everybody just move. There is no perfect or any solid rules to that. Do what you have fun doing and what your group enjoys doing, but try to do it, right? Get some movement in. Another thing we did with our worksite wellness program is we created a fitness directory. So we just polled all of our members, all of our colleagues, our cohorts to find out what their favorite fitness YouTube or fitness influencer, fitness program, brick and mortar or video was. We collected the information and we put it in a directory and we saved it in a spot everyone has access to. So new employees, current employees, if you're trying to find out a good workout video or a good workout person, you can go to this directory and it's already literally vetted by us because you're getting the suggestions and recommendations from your colleagues, right? So that's a great idea. And people love creating things or looking at things that their colleagues created. It would be your own a school district fitness directory, right? Put your logo on it or whatever, your school name, your school colors, and load it up. So mindfulness, movement, and nutrition. The last one, but probably the most important one, if I started talking about nutrition. That's why I started bringing more nutrition presentations to the Worksite Wellness Conference. It's so important to have that information, especially because most of our nutrition options are limited in health or nutrient-dense foods, right? And most of us are very busy, so we have to choose, or I won't say we have to, we are pressured into choosing what's available. So I feel like in my team, at least if we give you the information, that can give you more options, right? You'll know exactly what to do. So some things you can bring to your work culture, some different activities, a mindful eating challenge. Now, just like mindfulness, and you know, mindfulness is just a modern day term for meditation. And it's bringing your thoughts and your behavior together, your actions and your thoughts together. So, because sometimes you're doing things in the moment, but your thoughts are in 3 days ago, or perhaps in tomorrow. So you want to bring them together. And the thinking behind mindful eating is that when we eat and we're stressed, like our thoughts are scattered or we're mentally in different dimensions, right? That's a stressor. So our stress hormone is elevated, right? Any free tip, because you're MESSA members. Anytime your stress hormones are elevated and you're eating, now we're eating because we need the nutrition out of the food. Well, you can't assimilate the nutrition. It won't go where it needs to go when stress is high. When cortisol is high, our digestive process is off. It's suboptimal. It's dysfunctional, right? And how most of us are eating rushed, or we're eating worried, right? Or we're eating depressed. So that means I'm not getting the nutrition I need. So perhaps that's why every time I go to the doctor, my iron is low. Well, I've been eating iron-rich foods. What's going on? Or my vitamin D is low. Or I'm tired all the time. Perhaps mindful eating is the answer. I got digestive issues, Rhonda. I got food allergies. Perhaps mindful eating is the answer. So you're basically incorporating mindfulness, paying attention, enjoying your food. We love that, right? Thinking about it, tasting it, the texture, the color, the smell, bringing your thoughts into this action. And what the research and the health experts are saying is it can lower those incidences of food intolerances or digestive issues, right? And even the feeling of satisfaction after eating. It increases satiety. So that's something you can do a challenge for at your school district with those people in your department. Every Wednesday, we're going to do a mindful eating, okay? Or just when people can do it, right? Another thing, a nutrition activity we did at our Worksite Wellness program, we created a cookbook. So just like the fitness directory, We polled everybody about their favorite recipe. We did dinner. We did appetizers. I think we even did drinks. We did desserts. We did it every month. March is nutrition month. So we kicked it off in March, and we really didn't have the recipe book idea in March. It was organic. Everyone, people love food, even if you're just reading about it on a recipe. And it was so popular that we decided March, we said, oh, April, let's do it again. And we did it in May. And we ended up having a comprehensive recipe book just for the MESSA family. We stored it away. People have access to it. You can do that for your school district, and it'll last forever. It'll be a historical thing, right? People can go to it, and we know the dishes are good because Sally made them or Sarah made them, right? It's your recipes, your healthy recipes. You do it the way you want to do it. Salad jar lunches, recipe exchanges, create a newsletter. Create a newsletter, and you can easily do a one-page newsletter. This is what I recommend to people. You don't have to do anything comprehensive if you don't have a communication team. One page, you can do a couple lines or a recipe and a couple lines about movement and maybe a couple lines about mindfulness, or just the recipe, right? Or on your website, every quarter, put a new healthy recipe. Or again, the recipe exchange. Very simple things. This is probably the easiest thing. Talk to whoever arranges meetings. A lot of times I go to schools on opening days and there's donuts and bagels. Nothing wrong with that. I'm into balance, but perhaps some healthy options like vegetables, like some carrots, some broccoli, some yogurt, some boiled eggs. Talk to the people. That's what I call re-engineering the environment. Options, healthy options. We don't want to mandate. We want people to be motivated to make their own decisions. Autonomy is the way we want to do it, but we want to have access to those good, healthy options. That's the way we want to do wellness. Connection. Now, connection is intertwined in all three. When you create a worksite wellness program, you are creating opportunities for connection, opportunities for community, for people to get to know each other, for people to have fun together. There is a hormone called oxytocin, and oxytocin helps you bond with people. Most people know about it because the mother releases oxytocin for the baby, or not for the baby, in herself when she's breastfeeding. So it bonds her to the baby. But also oxytocin is released anytime you bond with someone, you hug them, you have a good time laughing with them. The oxytocin is released, right? So when you create these activities or these opportunities for people to come together and have fun. So this is the issue. Often for work, we come together and we're stressed because we want to complain and let people, not complain, I don't want to say complain. We need to let people know about the issues, and we're stressed, right? So even though there's a bond in that, it's a different kind of bond, right? We want to have opportunities to bond and laugh and crack up and have fun, or a little competition, So that's how you do walking challenges, or just and it doesn't have to always be health theme. It could be like, let's meet at this restaurant and just laugh. Free tip right here. Laughing, humor lowers your stress hormone. I saw in the chat earlier, somebody said, I need some ideas to help me with stress. Crack up, just start laughing, right? You crack up. And I'm thinking about us. I gotta have them laughing in this room. We're filming this from a new room. We're not usually here, so we had to set up yesterday, and it was so stressful. And we just laughed and laughed and laughed. And I can't even say I'm mad about anything because it was so funny. Laughter helps lower your stress hormone, right? So you know what that means? Let me tell you. So when cortisol is high, when you're dripping cortisol all the time, you are compromising your immune system, right? I don't know if you knew this. You are weakening your immune system. So you potentially are helping your colleagues stay well when you create an environment of humor and happiness, right? So I don't know why I'm saying this. Some of you might be walking through the office all stiff and stoic. You need to loosen up, have fun. Don't take yourself so serious. Laugh more, okay? It makes your immune system more robust. It makes you more resilient physically and mentally, right? So connection, right? Creating situations where people can be social, okay? Balancing personal time. Now, I'm talking about work site, but also family, connecting at home. Often when we get home, the people that we love the most, when we're talking to them, we're like this. Yeah, baby. Right? We're on the phone. We're looking at the cell phone. So even connection at home, connection with the kids, we give so much at work, we don't have anything left for our families or our community. So connection is important. Remember that oxytocin thing. Create opportunities to have fun with the people you love, okay? That produces bond. So if you have some people in your life that are irritating you, right? I create connections with fun. That's why couples go on vacations together. And I tell people, so you can remember what happened. Sometimes you got to think back. Oh, I used to love him back when we went on that vacation that time. But for great memories, it helps manage the moment, right? Are you with me in here? Y'all see me fanning myself. I can't wait for Dr. Munich to get here and Maria. So let's talk about MESSA. Because you know what? You have one of the best health benefits in Michigan. And we work to make sure that you realize that and to make it better and better. We're working better and better. I work with some fabulous MESSA field representatives, and some of you know them. They're not only working with you, but they come back after they've been with local presidents and they've been with our members, and they are fighting for what you need. They're not sitting down with that stuff. So when you let them know about an issue, please don't think they are sitting on it. They are in here fighting for you. They are letting the leaders of MESSA know the needs of the members, and the leaders are listening as well. And they're working hard to get you the benefit structure that can help you and your family, right? So you have access to support. When you think about MESSA and you have choices, you're sitting at the table. You have support here. We're here to help you. Personal support. You just don't call or have a chat. We have people that go out into the field to meet with you and to hear from you and to support you through your health and medical needs. Oh, look at that. And I didn't plan that. I didn't know they were going to be on this next slide. Here they are, the MESSA field reps. So they are in each part of the Michigan area. They're so cute. But I'm so serious, and I take them very serious. They're valuable. I respect them, and I want you to know about them because I hear how hard they're working. I'm working with them very hard. So I want you to know how important that is. Teladoc. How many of you have heard about Teladoc? Put it in the chat so I'll know. Teladoc is our way of bringing the Jetsons to modern day. Your opportunity to access healthcare in a digital manner, okay? It used to be, initially we brought on a resource where you can go to an urgent care type visit via your app on your phone. Well, we brought it full circle now. Not only are we bringing you urgent care type services, earache, migraine headache, little Jimmy has a rash, but you can also get primary care virtually, okay, and choose a primary care doctor. You can get mental health care via Teladoc, okay? They're probably putting a link to that to provide you more information in the chat. Coming soon, okay? We had Ovia in the past, and we all know about weight loss drugs will not be covered soon. Well, we have an answer for that. Like I said, every time an issue comes up, the leaders, the field reps, the people here at MESSA, they start to huddle and start planning. So we have a weight management program coming for you January 1 that can help guide you and provide you information and support through a healthy lifestyle to help you manage your weight, okay? Help you reach a healthy weight, okay? And that's coming January 1, 2025. We'll be reminding you throughout the rest of the year, and we'll definitely let you know when it officially launches, okay? And with that, we have our hypertension management program and our diabetes prevention program that is already available through Teladoc. So if you or a member of your family is challenged with high blood pressure, hypertension, or the doctor is saying things like pre-diabetes, insulin resistance, metabolic syndrome. Those are precursors to type 2 diabetes. You could benefit from our diabetes prevention program, okay? It's a part of your benefit. It's free, okay? So Teladoc would be what you need to be accessing, and I'm sure they have it in the chat right now for you. Medical case management. That was my first job at MESSA. I get warm and fuzzy when I talk about medical case management or those nurses, such that this conference, I brought the medical case management nurses here, okay? They're going to be talking to you and sharing some of the wonderful things they do in medical case management later on today. Let me just say, the medical case management nurses all have advanced degrees in nursing, as well as additional coursework in chronic disease management, okay, complex disease management, highly skilled and educated nurses that are here to help you with catastrophic situations. Let me shut up. I want to talk about them, but they're here and they're going to tell you what they do. So make sure you're here to hear that. Second MD. Of course, you can get a second opinion without second MD, but we brought this on as another opportunity, another resource, okay, for individuals that are, I'm a nurse, so I understand how the healthcare system can be. It can be complex for a layperson, for somebody that doesn't understand everything or what's going on. And sometimes people get in situations where my doctor's not telling me enough. I don't know what to do. I need help, somebody. Well, this is what second MD is for. You can reach out to them and they can give you a second opinion on your situation. That diagnosis that the doctor is saying it's a syndrome, or if it's, I don't know, or unknown etiology, those type of words, reach out. And if you have questions about second MD, you can go through our field rep, our MESSA field rep, or you can contact our medical case management nurses, okay? But this is a resource for you and your MESSA dependents, okay? And this is all wellness. This is all wellness. We want to give you what you need to minimize the healthcare burden, because that's stress, right? And the more we can minimize the chronic stress, the more wellness that you can receive, that you can experience. Ovia Health. We're going to be doing more to expose you to Ovia Health, but I want you to check it out. I want you to know about it. And I'm telling you about all these different resources so you can tell your members, you can tell your colleagues, you can incorporate it in your wellness events. You can have one of the field reps come out and talk about these, bring a healthy lunch. You can have me come out and talk about these and bring a healthy lunch. Your members should know about this so they can utilize these resources. Ovia Health is a program that supports women or families throughout the life stages, like when you are trying to get pregnant or planning a pregnancy, throughout the 3 trimesters of pregnancy, or even after birth. There is a program or information or resources to help you. Of course, you should always use your pediatrician or your OB-GYN, but we just have an extra resource here for you that can be helpful. Personal support and coaching is available. So those of you who express need for personal menopause support, Ovia Health can help you, okay? You can download that app and they can provide information and guidance through that. Mental health coverage. We want to make sure that we provide equal opportunity, access, and benefits for mental health like we do physical health. And we have mental health coverage that is very benevolent. We want to help you. So much of our physical health is determined by how we're thinking, right? So mental health coverage is available to you. My Stress Tools, we've had this for about 3 or 4 years. Again, mental health is very important. My Stress Tools is just what the name is saying. Tools and resources to help you understand how to not just manage stress, but master it, okay? And if you are not the person that needs it, you can be the person that provides the information to those people you influence. You're an influencer, remember? You're a behavior change specialist. So My Stress Tools, what you do is you log on to MESSA.org. And now it's the visual is a little different, the desktop. So at the top, you'll see other resources, and it's on the far right. Click on it, and it'll say Health Risk Assessment and My Stress Tools. Click on My Stress Tools, and it'll take you to the website, and it'll say your name, Rhonda Jones, right when you open it. And basically, it's a suite of activities that you can use. If you like videos, there's videos. If you like podcasts, like you're on the treadmill or elliptical, you like to listen to podcasts, there's podcasts available. There's interactive tools, there's coaching tools, the mindfulness coach, the resilience coach. And basically, it's information to help improve wellness and help you manage stress. Emotional intelligence is some of the topics, getting a good night's sleep, cognitive restructuring. Okay, so I imagine it that you can use it. And I remember a lot of people have screens in their break rooms and lunch rooms. So let's say you want to do a 28-day mindfulness challenge. You can, instead of going out trying to create this, you don't have a lot of time, you can log into My Stress Tools, pull it up on the screen, like I have it pulled up like this on a Zoom meeting, right? And the day one, hit the button, hit the video. Everybody in the room will get the 2-minute video. Next day you do it, day 2. Or let's say at your association meeting, you want to start the meeting with a mindfulness practice, pull it up. Or the parent-teacher conference, pull it up just easily. Any of the activities in My Stress Tools, you can pull it up like that. You can pull it up in the room with you and your family. So go check that out for me today. Go check out My Stress Tools. I want you to use it so we'll know if you like it, right? We bring resources on, and we don't want to waste time with things that are not useful. So far, I'm hearing that it has been very useful. Now, I'm gonna tell you this, what we're going to be doing, and you know what? I like everybody. And how many people are in this room? 100. I like 111 of you. I like all 111 of you. So I'm just telling you this right now today. We are launching an incentive program for My Stress Tools today. And you guys are the first to hear it, right? Nobody else in the MESSA world knows about this. What'll happen is, after today, when you log into My Stress Tools, you're going to see a box up there that says points, okay? And you're going to get points for every activity you do, right? From today until November, the end of November. November 31st is the last day of November. It ends that day, okay? Starting December 1, you can redeem your points for wellness gifts. And the wellness gifts are in there. You can see them, right? So the more you do, the more points you get. And then from December 1 to December 14th, you can redeem the points. Okay. And I just told you guys. Okay. So you can be the first out there. It's first come, first serve. You can start getting your points. Okay. So I'm going to have somebody come in later and talk more about it. Able to, this is another program, another resource for mental health. It's a little different than going to a therapist for a visit. You start this off and you create goals for an 8-week program, and you work with the therapist to reach your goals, okay? It can be, mental health, nutrition, exercise, habits are all used to help improve mental health. So that is what your therapist is going to be helping you with this. And this is a resource for you, okay? So Able to. Nurse Line, we still have Nurse Line available if you need to use it, if you need to talk to a nurse at 3 o'clock in the morning about a situation. We have it available, 800-414-2014. You can call them as a resource, okay? All of our resources, anything MESSA is doing, we like to share on social media. They in here rushing me, y'all. I got to get this information out. Is Jeff in the house? Jeff, give me a minute. Let me tell. I'm gonna give you all you need, but I need them to know about Facebook, Instagram, and we're on YouTube. Okay, this is gonna be on YouTube when we're done. If you want to stay up to date, we got some seasoned, what do you call the people that do the digital stuff? Social media consultants, I'm gonna call them that, but they make sure our social media stays updated with what we're doing, okay? And you guys know you have access to everything at MESSA.org. My MESSA, you log in. I'd be shocked if you don't have credentials to get in there by now. If you don't, go ahead and load and check out. You can check out your benefits and find out everything about your account, okay? And we have an app. Everything is on our app. Everybody's operating on an app, okay? Okay. One last but not least, if you're interested in meeting with me and talking about wellness ideas, starting every third Wednesday this month, you can meet me at 7 a.m. and 4 p.m. Me and some other MESSA people all over Michigan, and let's just talk wellness. Let's talk personal wellness. Let's talk wellness activities. You share your ideas. I'll share my ideas. Let's get together. Join me. You can register for that on MESSA.org. Become a wellness pro, right? With me. Come with me. Also, I can come out to you. You can call me or email me, and I can come out to your school district and sit with you or you and your wellness team, and we can talk, or we can do it on Zoom, and we can talk wellness activities. Let's reimagine our workspace, okay? Let's reimagine our own personal space, our own personal self. Right now, I want you to get in your mind a vision for yourself, for your workspace, for your home space. Start thinking now, because right now I got Dr. Jeffrey Gardier coming, and he's going to talk about how we create goals, okay? So you got to have the vision. You got to have the vision. If you need to reach out to me, you can email me. I was getting ready to say call. Email me at healthy@mesa.org. The number is on the screen, okay? I hope this information is helpful, but we're just getting started, y'all. We are just getting started. If you need to stand up and move around, do it now.